Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, how financial strain can increase post-heart attack mortality. Plus, expanding access to focused ultrasound therapy for movement disorders. But first, pig heart transplant recipient David Bennett passed away this week, 2 months after his historic surgery. I talked with Dr. Bartley Griffith and Dr. Mohammed Muhyiddin about Mr. Bennett and his legacy.
He was very brave, and he clearly indicated that if he didn't live long enough, he just wanted to be sure we could learn something, and I think that is really admirable.
We are very grateful to him. We are grateful to his family who also supported during this. We've been very much in contact with them, and they've been very supportive.
It's not yet clear what caused Bennett's death, but his condition began to deteriorate days before his death.
His heart worked, as I've expressed many times, like a rock star. Beautifully functioning. We couldn't have asked for a better organ. And normally patients would have been home in a couple weeks after a transplant of that nature. He wasn't able to overcome what turned out to be devastating debilitation from his previous period of heart failure, which was extreme.
This is the first time that pig organ has been transplanted in human, and there are a lot of unknowns that we can discover after carefully evaluating the data that we have accumulated over this period.
That we were able to take a genetically engineered organ and watch it function flawlessly for 9 weeks is pretty positive in terms of the potential of this therapy.
Doctors plan to conduct a thorough review of Bennett's case and publish the results in a medical journal.
Maybe the next one will be a little different. We'll do things a little differently, and maybe we'll have a little better outcome, and maybe we'll get further down the road to making this a practical reality for on-demand organs.
In our Discovery segment, the FDA has approved a focused ultrasound treatment device tested by School of Medicine researchers. The device, called xenotransplant Neuro, will be used to treat advanced Parkinson's disease on one side of the brain. The device sends ultrasonic energy to an area deep inside the brain that helps control voluntary movements.
The acoustical energy is translated into heat. So you're actually burning a hole, if you will, or knocking out a group of neurons, a small group of neurons, by heat. You're treating something that where there's pathology that involves brain cells by knocking out other brain cells. The idea of doing ablation has a very long history for treating particularly movement disorder Parkinson's, but then that's been expanded to other kinds of diseases. People that are treated with focused ultrasound are immediately happy. Some people actually burst into tears because they could see they could hold a glass of water before in one hand, but before that, the water would be all over the place. So the effect on patients is remarkable. This procedure is done in an MR scan. So when they come out of the MR scan, a lot of them become very emotional.
Parkinson's disease affects more than 1 million Americans. In other research news, School of Medicine scientists have discovered that older adults under financial strain are more likely to die within 6 months of having a heart attack. The study looked at data from nearly 3,000 heart attack patients over the age of 75.
7% of the heart attack survivors were severely strained, and those older adults were substantially more vulnerable to dying within the next 6 months, even after accounting for how long their hospital stay was, what kind of surgery they had for their heart attack, and other medical factors that we accounted for that really suggest that financial strain is a predictor of mortality, and one that's particularly a little bit novel and hasn't been previously identified.
The study says hospitals should ask about a patient's financial well-being to help identify vulnerable patients.
Financial strain isn't only capturing people who are living below the poverty line. It's capturing people who might be, not traditionally low income, but have high medical costs or other costs that make it challenging for them to meet demands associated with a heart attack.
Finally, more than $4 million in medical supplies is headed to Ukraine, thanks to a joint contribution from the University of Maryland Medical System and Johns Hopkins Medicine. Donated supplies include airway aspirators, medical air compressors, beds, ventilators, and syringes. Meanwhile, Dr. Robert Reed has set up a GoFundMe page as he coordinates a trip by Baltimore area doctors to help Ukrainian refugees in Poland. Among them, his wife Anna, a pediatrician.
My wife inspired me to get involved in what we're doing. She herself fled Poland when she was 3 years old and can really empathize with the plight of the Ukrainian people.
And that's Frontline News. I'm Larry Roberts. We'll see you again in 2 weeks.